Welcome back to the Two Promises podcast. Let's dive right into another exciting adventure with BD and crew as he pursues his new passion of one day finding the best, most epic bourbon. The Two Promises team sends their special thanks to Hobie and the Huckleberries for that masterful theme music. So grab a glass, relax, and enjoy responsibly.
Baby says she's leaving if I don't stop drinking wine. So I switched to whiskey, now I'm feeling fine. Drinking that smooth, smooth whiskey. No more wine. I like straight bourbon. Baby, you try the ride.
Welcome back, everyone. I'm excited to have a special guest from last month back. We are renewing the experience with Julie and Renew. She has decided to come back to us, sharing a little bit more because I actually asked her to come back and share a little bit about her experience as a massage therapist from a different angle. And here's why. So whenever I was a young sailor and traveling around the world, I found myself in Thailand. We're restricted to base and we're hanging out there and we're waiting for whatever it is that we've got going on, but they have some vendors set up there on, where we're at, that's just selling little trinkets or whatever, and they have like a little massage booth, right? And it's, like a little tent, but there's just these like old army cots like lined up in there, and they have like all these ladies, and they have these, they're not really tool belts, but they're almost like little baskets with these like stones and like all these like they really looked like torture devices. And I'm like, well, yeah, sure, all right. So, oh man, it was probably one of the most painful experiences in my life. They took those, not all of the massage, but they took those stone things and they just ground them into my feet, you know what I mean? And I've noticed that, the reflexology piece is something that here in, on the Western side that we don't use as much. We're not as familiar with, I guess. So in terms of familiarity and stuff like that, it's pretty normal for someone who's not really familiar with what's going on to have a little bit of anxiety in some of those situations. So what I would ask you is, what would you be able to share with someone who is considering, say, massage therapy as part of their healthcare, self-care routine, so that maybe you could walk them through what to expect so that you can reduce some of that anxiety for our listeners?
Yeah, absolutely. And I think one of the big things is to help with some of that anxiety and to get the most benefit out of the massage is to basically show up 10 to 15 minutes before your appointment. And especially if you're a brand new client to that massage therapist, you want to give yourself time to go over the health history form. And that's really so important for us to isolate some of the medical issues that you may have, or look and focus on the areas that you're needing to be worked on. Kind of gives us a general idea of what kind of treatment we need to provide you. And so I would say that's probably the main thing that you can do is come out 15 minutes early, calm yourself down. You're there. You're no longer rushing. Fill out your health history form. And then another one is you're already there. You have time to sit and relax and then use the washroom. This will also help benefit how much time you're actually going to be getting for treatment. Because as soon as you get on the table, that's usually what happens. Or if someone's getting ready to go on the table, they're usually coming out of the room and like, can I use your washroom real quick? So that's basically just taking away from your 60 minutes or 30-minute massage treatment, and then it feels rushed. So to maximize it, come 15 minutes early, use the washroom before the massage therapist comes in to take you into the room to perform the treatment. And another one is the distractions. So turning off your cell phone or putting it on vibrate if it's really important that you need to have a call, just so that you don't get interrupted too much.
Again, thanks for being on the show because, you carried the show last time. I'm really expecting you to carry the show again this time. That's really why I got you on, because I'm been a little bit under the weather lately, so I needed some of my star friends to come in here and pick up for this one. So, you've got some recommendations. Show up 15 minutes early. So that gives you time to do a patient history intake form so that you can discuss any health concerns that you might have, maybe the reason for being there, and any other associated injuries. That way you can, because you're having to make a quick adjustment based on whatever it is that they're coming in.
That's right.
So you're already kind of on the spot as a therapist, as a healthcare provider, on how you can, benefit this person, especially if they're a new client. Yeah. So sometimes whenever I'm in a rush and I'm just going into places, I just think that the people already have all the information on me that they might need, because I'm constantly feeling the pain or feeling this or, dealing with said problem. And I don't necessarily always give enough time to communicate that and answer the questions the other people need to understand clearly. So that's one thing, given the time for that.
Yep. And then I would say for there's no silly questions. We really need to know, what kind of job you're doing, if you're a manual laborer or if you're sitting at the desk. That also gives us a little bit more clearer picture of what might be an issue, right?
Absolutely.
So what to expect when you're coming in for a massage, it's your idea for a massage is so important, just as much as important as to my idea of what I need to do for a massage. So I like to think that the massage therapist and the client are working together to come up with a treatment plan that's very customized to the client that's coming in.
Oh, yeah,
so you have just as much say as I do, right?
Absolutely.
And that's where we sit down and we go over their health care. We talk about the issues that you want to address. And say, for example, you have low back pain. And immediately, for me as a massage therapist, I think glutes or butt and shoulders and neck, all of those. I always focus on the low back and what's above and what's below, because they're so interconnected that you can't just work on one area and not work on the above and below, because they work together.
Absolutely. I mean, even just from an emergency perspective, I just like to try to cross principles, even if it might be a slightly false comparison, but it's a principle that can overlap. So in the emergency medicine world, whenever we talk about splinting, we're going to splint a joint above and a joint below. And it seems like from what you're talking, you're going to work an area above and an area below, because they are interconnected, and whenever you can provide relief in one area, a lot of times that releases the other area. That's
correct.
Awesome. Yeah. Another thing, before we move too much further outside of the check-in process, because there's one other thing that you said there that I really, really, really liked, and I want to kind of bring us back around to, was, hey, you're already here, now just take that breath and be calm.
That's right.
So you've already blocked out that space, you've made it that priority, so now maximize it. Honor it. Don't let yourself be cluttered with the past or with the future. You've made this space for yourself, so don't steal it from yourself.
That's right.
Okay, back to you.
Yeah. And so when we're coming up with a treatment plan, in order for us to create a treatment plan, we have to give you all the information, so to make an informed consent. And that comes from just talking about pain level. How much pressure do you want to apply? It's so important, because some people are like, oh, I need a lot of pressure. But then once you start working on them, you can feel them fighting you. And then that, as a massage therapist, I'm like, is that too much pressure? Because if you're not relaxing and you're guarding, I'm actually going to start stripping and injuring the muscle tissue. So it's so important to be completely honest. Yeah, you know what? That's a little too much pressure. And we're more than willing to decrease the pressure so it's more comfortable for you and you get a better massage.
Can you explain maybe what the target pressure that they can think of to explain or to feel? Because...
Yeah. 0 being no pain, 10 being the most. That's kind of our gauge. And for me, I would say around moderate. So around that 5, 6, 7 kind of pressure is it's the perfect pressure to apply. It's not too light where you don't feel like you got in a massage.
So you're thinking maybe
like
where you're, numbers are kind of hard. I'm sorry, I'm not trying to interrupt, but maybe describe a feeling or a sensation of
0 being no pain whatsoever, you're feeling great. And 10 being the most pain, like you've broken a bone. That's like your max. Does that
No, I'm
explain it a
understanding
bit?
that. I'm understanding that.
Yeah, okay.
I'm sorry.
Okay.
Go ahead. You keep going.
Yeah, so a medium pressure is around, you've got a little discomfort, but it's a good feeling. So it's like a little bit of pain, but it feels good to have it worked out.
That's the phrase that I was looking for. So there's some discomfort. Because I knew that there was something there and I wasn't quite connecting with it. So there's some discomfort. There's a little bit of uncomfortability, but it's geared towards the relief. It's like if you push through it, if you allow it to go through a little bit, there's going to be a relief on the other end as opposed to the building up of more pressure.
Yeah, and you'll know
does that sound right?
Yeah, that's
okay.
Absolutely.
Right.
And you'll know you're at that point when you can handle the pressure and you're still able to breathe through it.
So
Because
breathing.
the moment you start breathing,
okay.
So the moment you stop and you kind of clench up and you hold your breath, it's a good indicator that the pressure's too much.
Okay.
So those are little things that you can look at. Like, am I able to breathe through it? If I am, then it's a great pressure. And usually when we talk about that, I also talk about the next day or the 24-hour period after a massage. It's a good indicator. If you're sore for more than 4 days after you've had a massage, it's a clue to the massage therapist and to you that it was too aggressive. So ideally, you want to feel... Pardon?
You got a 4-day rule.
A 4-day rule. So within 24 hours after a massage, if you feel a little discomfort and then the next day within the 36 hours it's gone, that was perfect pressure for you. Because I always tell people when you're coming in for a massage for the first time, you're going to feel a little sore the next day, but it's like you've gone to see a trainer and you've had a good workout.
Okay.
Because I'm literally manually manipulating the muscles to release the tension and to lengthen them so that you have increased mobility, increased range of motion, and just we release the tension. So, yeah.
So also from a mobility and a recovery standpoint, exercise is a way to get those muscles moving, to get blood flow through, and that's why whenever we're talking about healthy lifestyles and the importance of exercise is it helps move blood and all of the things that the blood does through the body, cleaning the body, repairing the body, and getting, all the waste out. You're telling me that what you're using in your practice is you're manually you're kind of doing parts of this for the body so that you can promote this blood flow, and then that is almost like working out.
That's right.
Physiologically speaking, it's the same thing as having a workout outside of the effort that the individual puts in.
That's right.
You're doing all the work.
We're doing all the work. You're just
thank you for that.
Trying to breathe and Yes, it's pretty cool.
It is pretty cool. Okay.
Yeah.
All right. So.
And I guess after that, if it's your first time and you're not 100% sure how to get on the table, we explain that. We do it pretty good. We say, okay, I'm going to leave the room to allow you to get ready and to prepare yourself. What we'll need you to do is to remove the clothing that you, as a client, feel comfortable with removing. And if you don't feel comfortable with removing any clothing, that's perfectly fine. We can do a stagnant kind of technique instead of more of a glide with lotion and oil and skin-to-skin touch. Because in my field, if you're not comfortable, you're not going to have a very relaxing massage. So we want you to feel at ease, at peace of mind, relaxed, calm, so that we can actually give you the most benefit of massage. So typically, we ask for you to leave the underwear on and everything else can be removed. And then once you're ready to get on the table, you will actually literally slide in between the two sets of sheets and the blanket. So the bottom sheet, you lay on that, and then the top sheet and the blanket goes over you, like it covers you, like if you're going into bed. And then typically, depending on what we need to work on, we'll either tell you to face down on your stomach with your head in the headrest, or we'll have you face up, depending on what areas are most focused. So,
and some places may provide attire for you to
towels.
wear. Yep, towels, robes, any of the undergarments, and sometimes even slippers or whatever. Each place is a little bit different, so just they'll walk you through that piece.
Yeah,
That's something that
absolutely.
you'd expect. And
So
probably
then
if
you
you
don't
have
have
any
to worry.
questions, just ask.
That's right. And that's usually what I ask. Do you have any questions before I leave the room to allow you time to get on the table? And then I always specify, I will knock on the door and I'll ask you, are you ready? And then once you're ready, you can let me know. I can come back in by say, yes, come in. And then that's when the treatment starts. And a lot of the techniques that we use are the general Swedish massage treatments, which is like effleurage, tapotment, muscle stripping, kneading. There's like so many different things, but for the most part,
break down one of
I
those.
use-
Like break down one of those and what its
Benefits?
intended purposes. Yeah, there you go.
Yeah, for effleurage, it's basically just to introduce the touch. It's a little bit lighter. It helps get the blood flow going and moving and warming up the tissue.
What do you do? Sorry.
I start off with effleurage every time because, one, it's introducing my touch to the client and letting them know that it's a safe environment. And then it also helps with the parasympathetic. It gets that started to calm you down.
Excellent. What is the technique, not the result? You're telling me all the benefits that I'm
so the
receiving. So
technique
what do
is-
you do? What is the touch that you're applying other than just the word? I can't understand from the word.
So the way I move my hands, it's very smooth, long glides up and down, kind of like your back, and then I can kind of move around and do side to side.
Okay, so this is a
movements.
lighter pressure.
It's very light,
Very light and very long.
and very long. So
Okay.
I start with a light pressure, and I go from the head, neck, and shoulders, and I move my hands down to the low back,
Okay, and that
and
is
then
called.
I move it back up.
Okay, and that's called.
Effleurage.
Awesome. Thank you.
Uh-huh.
Now I learned
You're
something new. Effleurage.
And then I usually go right from effleurage into a little bit muscle stripping, which feels almost exactly like effleurage, but I'm applying a little bit more pressure. And it's the same thing. I can do long strokes, so from the neck and the shoulder, where they meet, and I can put a little pressure and go down in between the spine and the scapula. And I can put a little bit of pressure and I can go all the way down to the low back. So it can be really long strokes and pressure, or I can actually just work on a certain area, like in between the shoulder blades, like the shoulder blades and the spine. I can work on that kind of fatty, meaty tissue there and just do some quick movements with a little bit of pressure, and that's also muscle stripping.
Okay. Excellent.
Yeah.
Effleurage into muscle stripping. So you're going to
Muscle
go
stripping.
a little bit more pressure as you move into that. Okay, awesome. So then what's next?
Then I would do some muscle kneading. So with that, I actually use my thumbs. And let's take a look at the shoulder blade again, or even into the neck. I would use my thumbs and apply a little bit more pressure, and I'll do circular motions in between the shoulder blade and the spine on that rhomboid muscle, or I'll even go up into the upper traps, the supraspinatus, and do some muscle, some kneading there. So basically what I'm doing is I'm going superficial, deep, a little bit deeper, to get into some of those deeper muscles and underbelly fibers.
Yes, excellent.
Yeah.
So kind of some of the process that you're describing, I'm just going to kind of relate to a little bit. Again, a different side of healthcare that I'm a little bit more familiar with is your kind of progression. So we would have, say, if I'm going to do a procedure on someone, I'll explain it to them, if they're conscious, obviously, all that informed consent, I'll have that. And then if I'm going to work an area, I'll talk them through it, and then I'll say what they're going to experience. And then usually we'll do like a neutral touch, which almost sounds like your effleurance or whatever, where I might touch an area kind of near that body part, with, like, say, the backside of my hand or something like that. And then, as I'm talking them through it, then I'll actually initiate the procedure on the area of the anatomy that I would need to do, like, say, an IV or whatever it might be.
Yeah.
So that's kind of how a different healthcare provider might be able to relate to some of the same things that you're talking about. Okay, excellent.
Yeah. And then there's like so many different other techniques. Like there's some fascia techniques where we don't use any oil at all. And it's where, have you ever had someone take your arm and torque it? So one hand grip will go one direction and the other hand will grip and go in the opposite direction. And you get that burning, instant burn feeling like something's tearing.
Yes.
Yes. So that's kind of like fascia work.
Okay.
We don't use any oil with it. And typically I let people know ahead of time if I need to do some fascia work, if there's something that sounds like there's some restriction, whether it's connective tissue restriction or scar tissue restriction. I let them know right away that if I am to do that technique, there's going to be a little bit more pain than that 5, 6, 7 on that pain scale for them.
Okay.
So they may hold their breath, but I just let them know that try to do your best to breathe through it because it's going to feel like a burn or like a bruise, but it needs to be torn up so that you can get the relief and the lymphatic flow, the blood flow to that area and range of motion increased.
Good to know. Good to know. Did you have that was fascia.
That's fascia.
And will you
do
you mind describing fascia for our listeners?
So fascia is it's a whole bunch of connective tissue, and it really does play a part in the range of motion. So hydration's really good for it, but...
So it's kind of like the connective tissues or the tissues kind of between the muscle layers. Is that...
Yeah.
Okay. Something along those lines, at least fairly close to that, and that you need a little bit of... In this space, you're holding in some things, toxins, metabolic waste products, anything that the body's doing in that area where there's all these little chemical processes going on, things happen there. So those things can get trapped in different places. A common place for things to build up and get trapped that we don't always think about is the fascia. And this particular part of the massage process helps kind of detox or kind of flush out parts of the body that don't get as much blood flow and movement as other parts.
Yeah, exactly. And sometimes if I release the fascia first, then I'm actually able to get into the muscles way better. So even the fascia can sometimes restrict me from going into those superficial, deeper layers because it's too tight. I can't get in. So sometimes I have to break that down before I can even get into the muscle layers to help stretch those out, get them moving, and loosen them up.
How would you be able to maybe, if you're feeling some resistance, how would you be able to work through that to get deeper with maybe the patient or the client?
I can do it. There's like stretching techniques. I can do a pin. So like a pin and stretch. So basically I shorten the muscle. So if we're working on the shoulder or like the pec region, I actually lift the arm up and bring the arm across the body with one hand. Like I'll help raise their arm up for them. And with my available hand, I'll kind of like a fist in their pec region and put pressure on it. And then once I got a good grip with my fist, I will use the other hand that I'm holding their arm up, and I will literally bring their arm down and up and stretch it. So then I'll pull their arm away from their body. So it's no longer close to their body. It'll be away from their body. And that's some fascia work too, because a lot of people that I've done that with, they're like, oh, I feel the burn. So, yeah. But then as soon as the fascia releases, they've got lots of range of motion. They feel great.
Awesome. So do you have anything else? We're about to get into our closing section of the show. It's been awesome having you. I just want to give you some time to kind of wrap it up, and then I'll have a couple questions for you here at the end. But before we get to that, I know we just kind of had some dialogue and you had some notes prepared, and I want to make sure that you get through the things you feel like you'd like to hit. So I'd just like to give it back to you if that's all right.
Yeah, I guess some of the questions that some people may have are like, how often should I get a massage? And that's typically depending on the injury or what you can financially afford. So typically I would say month to month would be the best, or either quarterly, just to help keep that maintenance and the preventative measures in play there. And who can get massages? And I massage 1-day-olds to 99-plus-year-olds. So everyone can get massages. Everyone can benefit from massages. And I feel like just do your homework, do some research, Google some massage therapists out and try more than one out to see who fits with you.
Sounds awesome.
Who you're comfortable with, yeah.
I love it. So thanks again for having me on the show, or for coming on the show. Thanks again for coming on the show.
Thank you for having me. It was so much fun.
We're not done yet, though. I'm excited.
Oh.
This is where I get really excited. Okay, so we've been working on doing like a 30-day yoga challenge. But
That's right.
You and I have been working on doing a 30-day yoga challenge.
Oh, yes, we have been.
Yeah, and then I got a hernia and all kinds of crazy stuff. And so I think now would be a good time for us to get back at kind of recommitting to that accountability piece for the 30-day yoga challenge.
I agree.
Awesome. So what other goals do you have? I know we talked a little bit earlier that you're looking into expanding some of your moves.
Yeah, I want to maybe do like some core workout, just because, as a massage therapist, we get injured too. And I just feel like right now my core is really, really weak. So I just need to increase that strength and get that mobility back for my core. And then I think yoga would also help with that as well.
Absolutely. I was thinking more professionally. You said you were looking into teaching. Did you say that?
Oh, yes. And then teaching, I had this idea that I would like to teach maybe like a couples massage therapy course, maybe 1 or 2 nights a week, if anyone's interested. And just kind of basically have like a date night for couples, because I think couples need to reconnect, especially during this crazy time. And what fun way of doing it, right?
That sounds awesome.
So I'd be able to show them like the general Swedish massage techniques, but on a very light kind of atmosphere, because I feel like if you want to go in deep, you really need to be trained at it, because there's so many structures that you could hurt. So
absolutely.
Yeah.
So that's another thing. Least invasive to most invasive is a thing that we'll do. So that's kind of your flow. You're going from superficial to deep. So these principles, they really translate across the board in a lot of these healthcare things, which is pretty awesome. So off of that, so now we've got yoga stuff that we're committing to kind of doing a little accountability piece. And now you're wanting to set up a course. So how do you feel about coming back on the show in a few weeks? We can set it up later. And we can just kind of check back in on how we did with the yoga commitment, and you can maybe update me with how your course development's going.
That would be great.
Excellent. I am super excited. Thanks again, Julie. Thanks for being on the show.
Welcome. Thank you for having me. Always a pleasure.
Have a great day.
You too. Bye.
Thank you for joining us today on this curious roller coaster of life. If this is your stop, please exit peacefully and enjoy the rest of your day. If you're ready for another one, just push play. A final note before you go: thank you. And thank you for feeling. The distillation and aging process is different for everyone. I'm not quite sure what you're ready for, so please sip slowly and enjoy responsibly.
Baby says she's leaving if I don't stop drinking wine. So I switched to whiskey and I'm feeling fine. Drinking that smooth whiskey.